Hello, everyone, and welcome to today's webinar, The Importance of Incorporating the Patient Voice within Global IME. My name's Mia Hill, and I am Acting Managing Director at SES, Scientific Education Support. So we aim to keep to 45 minutes session, and the agenda is on screen. So we're going to start with a little bit of a welcome and an introduction very briefly to who SES are. Then we're going to jump straight into our panel discussion for today, and I'll introduce all of our panelists in a few slides' time. We will have some opportunity for questions and answers from the audience, so there is at the bottom of your screen a Q&A button. Please do pop in any questions you have along the way. We will make note of those and try and answer as many as we can in the question and answer session. And then at the end, we're going to have just 5 minutes from our partnerships team, sharing some of the cases of the work we're doing at the moment here, incorporating the patient voice within our educational programs at SES, and explaining how you can get in touch if you'd like to learn more about supporting any of these educational programs. Next slide, please, Beth. So just a little bit about who we are at SES. We are an independent medical education company. We work in providing independent medical education for healthcare professionals via our hubs. So we have 9 hubs live at the moment, 7 in the heme-oncology space and 2 in the immunology space, and looking to launch a few more in the future. We also run patient awareness and education campaigns as well. So this puts us in a really unique position where we have experts in-house in patient education and healthcare professional education. And one of the things which we're really keen on doing is incorporating the patient voice into our healthcare professional education. And it's something which we've started to do in many different ways. If we move on to the next slide, Beth. So across all of our programs, we start by doing an educational needs assessment, so working out what the educational needs are in the space that healthcare professionals need to solve practice gaps and knowledge gaps in their clinical practice. And as part of this needs assessment, we do literature reviews, we have discussions with the healthcare professionals themselves, but importantly, we also interview patients as part of this to see what they think the healthcare professionals need to improve on. We work with patient societies and interview key members of their boards as well. And we also do social listening activities, so looking at social media, patient organisations' social media accounts, and looking at what key trends are in terms of patients asking, conveying their problems and which ones we can solve. We then take this through into educational design. So we actually invite patients to sit on our steering committees alongside healthcare professionals to make sure that their voice is heard, and ensure that when we're designing any of our educational initiatives that we're taking their perspective on board. We work with patient advocacy groups too, and have their collaboration with some of our educational profiles to make sure that we're hearing their voices. And we also work with patient societies as partners, both in the educational design and also in the dissemination of our educational programs as well, to make sure we are reaching as many people as possible. We also do ongoing literature reviews, and these don't just focus on the healthcare professional side of things or drug updates. We also look at those social listenings, looking at patient articles of interest, and make sure that they build into the education that we're producing for our programs as well. And then as a step 3 evaluation, we look to see whether all of this has worked. And mainly we do this by almost repeating step 1 and circling back and interviewing those same patients, speaking to the societies and speaking to the people who sit on our steering committees and collaborative groups to see whether or not what we're doing is working. So if we jump to the next slide, that was a little bit just about SES and what we're doing at the moment. But we've invited some of the people that we're working with here today to talk to you about why we're so passionate about this and why we believe it's something that all medical educational companies should be doing in creating healthcare professional education. So today's discussion is all about the importance of incorporating the patient voice within Global IME. And I'm joined by a few people. So next slide, and we'll do some introductions. So first on the list is Carl Harrington, who is a WM patient himself and past president and chairman for the board of the IWMF. So Carl, I'm going to pass over to you and let you further introduce yourself. And I'd also like you just to open the discussion and explain why you believe it's important to incorporate the patient voice into education.
I'm happy to. Yeah. Again, my name is Carl Harrington. I'm a WM patient. I was diagnosed in 2006. I was 56 at the time. They told me I had 3 to 5 years to live. Tomorrow, I'm actually going to see my oncologist. I'm hopeful he'll confirm that I'm still alive. I think I am. WM is a rare disease. It's a non-Hodgkin's lymphoma. About 1,500 people a year get diagnosed with it in the US, 1,500 a year in Europe. It's maybe 1 to 2% of blood cancers, and blood cancers are about 10% of total cancers. Now, WM, as I say, is rare, and it's rare for doctors and it's rare for us. The mission of the organization is, the vision is very simple. We want a world without WM, and the mission is also simple and well focused. It's to support and educate everyone affected by WM to improve patient outcomes while we advance the search for a cure. And the patient voice is critical because we're a patient-founded, patient-funded, and until 2020, patient-led organization. Okay, Mia?
Lyndsy Ambler join us today, who is one of the patient representatives who sits on our Lupus Hub steering committee. She has had to drop out at the last minute, but has sent us a voice note introducing herself and explaining why she believes it's important to incorporate the patient voice into education. So, all going well, we're going to hear from Lyndsy now.
I think that patient voice in education is really important. Patients really are our best place to understand what the actual reality of living with a health condition day to day, week to week is. They know the inside out of how their condition, or maybe the medication for their condition, affects them, and all the different ways that impacts on their whole life. And really being able to understand that, I think, is really key for making sure that the care patients get is focused on them and what they need, and it is really like holistic. I think the only way to get at that is to hear from patients and include the patient voice in education, because, like I said, the patients are the ones that really understand the reality of living with that condition and what that means, and therefore I think the only ones that can really provide that broader kind of authentic perspective.
Kind of represent that healthcare professional side of things. So, Ricard, would you like to introduce yourself and let us know why you believe the patient voice is important from a healthcare professional's perspective?
Yes, thank you, Mia. Nice to meet you and all the attendees to this webinar. I am the head of the Department of Autoimmune Diseases at the Hospital Clinic in Barcelona, as well as Professor of Autoimmune Diseases at the University of Barcelona. And since last year, I am the chair of the Lupus Hub, one of the most recent hubs of SES. And we, in the field of lupus, we are probably pioneers and champions in incorporating the patient's voice into education, as well as into research and all the clinical activities that we perform in the field of lupus. We were one of the first group of physicians that incorporated the patients' organizations into the lupus congresses in the 80s of the past century. And this has been of paramount importance, thanks to the this incorporation of the patient's voice, we have learned that there are two types of manifestations in lupus. What we now call type A, the ones that we physicians were very interested always, that were the inflammatory manifestations of lupus, but we have recognized, thanks to the patients, that they are type B manifestations, that are the ones that probably are more important to the patients, that are related to quality of life, that are fatigue, aches, pains, brain fog, anxiety, depression, and other similar manifestations that are extremely important. So really this experience that we have in the field of lupus reinforces the importance of having the patient's voice incorporated in all our activities, especially in education.
Thank you, Ricard. And finally, we have Cheryl. And Cheryl is working with us as a steering committee member for our MPN-PAG Collaborative as part of our MPN Hub. Cheryl's also a patient advocate and founder of Heal Canada. Cheryl, do you want to add to that introduction and provide your perspective?
Absolutely. So I come to this organization or this collaboration as a care partner or caregiver to my late husband, who had was diagnosed in 2020. Sorry, I'm getting my dates wrong. Anyways, in 2010, he was diagnosed with myelofibrosis, with previously being diagnosed with essential thrombocythemia, a rare blood cancer known as myeloproliferative neoplasms. Unfortunately, he lost his life due to his disease in 2018. And I was his care partner, and throughout the whole journey. And, I just believe that having patients part of their decision-making, it is their choice, it is their life that they're living with, the disease that they've been given a diagnosis in. And it's so vitally important to include the patient, in all the communication that is happening with their physicians and allied healthcare professionals, because really patients nowadays are much more educated in their journeys and the diseases that they have, and want to be part of that communication. So that's why I became very involved in patient advocacy and being involved in that, patients having a say in their journey and their diagnosis.
Thank you, Cheryl. So we've talked a little bit about the importance of incorporating the patient voice, and I think everyone in agreement who's joined this webinar knows how important it is. But I guess practically, how do we go about doing that? So my next question to all of you is just to take a little bit of time to explain how you're working with or are going to work with SES to do that and incorporate the patient voice. Carl, are you able to kick us off?
Sure, I'd be glad to. Well, as I said before, the IWMF is, or WM is a very rare disease. There's only about 1,500 people a year diagnosed here and 1,500 in Europe. That means it's really rare. It's really hard to find information about the disease, particularly years ago. And it means that most community oncologists see 0, 1, or maybe 2 of us in their entire career. So WM, and the last time they what came across WM was when they were taking their boards. So they're not familiar with our disease. Our disease also isn't cooperative. Although it's a single disease, we have a saying that if you know one WM patient, you know one WM patient, because it manifests itself in many, many, many different ways. So it's essential that we communicate, and as patients, we know exactly what it's like to be told that you have a rare and incurable disease and what that means to you and to your family. We have a promise that we make to our WM community, which is that with the IWMF, you're never alone, that we will always provide the support and the education that you need. And we started something called the Global Patient Initiative because we wanted to make sure we were doing as good a job globally as we have been doing in the United States, where the IWMF was founded. We like to say that, a patient in India has exactly the same disease as a patient in Indiana. May manifest itself differently, but it's exactly the same disease. They need to know and understand the disease and the likely course of the disease. We also know that the needs when you're diagnosed, you have the same questions like how long am I going to live? Are my children going to get it? All these sorts of things. So we want to make sure that people in patients or caregivers in London, England have the same information as people in London, Ontario, or New London, Connecticut. So we started this global patient initiative working with SES, trying to make sure that we communicated to the world what we already know as patients. And we want to make sure that we increase awareness first among doctors. The first person who knew I had WM wasn't me, it was my doctor. It would have been oh so nice if he'd referred me to IWMF and the wealth of materials that we have, but he didn't. And most doctors don't do that because they're not aware of WM. So we're working with SES to try to increase oncologists' understanding, particularly community oncologists' understanding. Also, increasing awareness of the IWMF so patients will come to us. We've got most of the information that you need. It's all free, all available. You just have to find us. And then we want to be open to bringing more people into the organization and building the awareness. And SES has been a perfect partner for us. Perfect in terms of increasing patient awareness, increasing first doctor awareness, so that they will tell their patients. And also we want doctors to be aware that there are experts in our disease and people that they can go to for a second opinion, particularly with the hard cases. So far, as I say, SES has been a perfect partner in helping us achieve our goals in Global Patient Initiative of expanding first doctor awareness, then expanding patient awareness.
Oh, it's lovely to hear that. Ricard, what about you and your work on the Lupus Hub with SES?
Well, lupus is more common than Waldenstrom involved, so it can affect approximately one person in 2,000 people. But the main problem is that it is a very complex disease. We certainly don't have two patients with lupus that have the same manifestations. The patients with lupus is the more representative of the autoimmune diseases. The autoimmune diseases are the diseases where the immune system, what we call our defenses, becomes crazy, and instead of defending ourselves against infections, they attack ourselves. And they can attack in lupus, they can attack any part of the body. They can attack the skin, the joints, the kidney, the brain, the blood. And in each patient, this can be different. So due to the complexity of the disease, education is extremely important. Education, especially starting with physicians, starting at the GP, at the general practitioner, who will be probably the first doctor who will be in touch with a patient with lupus, and that must recognize that the symptoms that the patient presents can be due to lupus. And also to all other specialists, because being a disease that can involve any part of the body, any specialist can be in contact with a potential patient with lupus, a dermatologist or a nephrologist, a rheumatologist, a hematologist. So also it's very important to have to increase awareness, to increase the education of the different specialists. Certainly, those real true specialists on autoimmune diseases also have the challenge to know always more on this condition. Fortunately, there are new improvements. We know better on the mechanism of development of this disease. We know more on the potential therapies. We have new therapies recently developed. So it's also very important for the specialists, the autoimmunologists or the lupologists, to know better on lupus. But, and last but not least, it's very important to have patients into this team. It's very important, the education of patients. It's very important not only to inform, to educate, or to explain the different problems that the patient can face over the years, but it's also very important to have their opinion, to have their feelings, to propose. They can propose what we must focus on, which is the research that we must perform, which are the new parts of the hospital that must be focused on the management of patients with lupus. So this is one of the things that we expect to have through the Lupus Hub at SES.
Thank you, Ricard. And I think we'll jump over and hear what Lyndsy had to say. So as a reminder, Lyndsy works with Ricard on the same hub, the Lupus Hub, but is that patient voice or one of the patient voices. So
I'm a patient representative on the SES Lupus Hub Steering Committee, where my role really is to get involved in the discussions and share my views on my experience as a lupus patient. So I was initially interviewed as part of the needs assessment process that the SES team carried out to understand exactly what topics the hub should be covering. And then I was invited to join the steering committee, which I did. And as a member of the committee, I've been involved in discussions about the most important topics for the hub to cover, as well as discussions about specific pieces of content that the hub is working on, most recently around the goals for treatment for different groups of patients.
And finally, Cheryl, do you want to talk a little bit about the work which we will be doing together in the MPN space?
Absolutely. You know, it's really important. Patients who are more knowledgeable about their disease have a better adherence to treatment options and opportunities to have a better understanding of a disease that they have no control over. So, you know, one of my tenets or one of my communications to patients is the more you know, the more you have control over a disease that really you have no control over. So helping you understand what the disease is, how you can educate yourself, and how you can really have the knowledge is the power that you have over that disease that you've been given a diagnosis on. So through SES and our collaborative efforts, really it's about educating patients, helping them help their doctors to live better with the disease and have better quality of life, which is so vitally important to patients who there is no curative opportunity for them to have with these types of diseases. It's really about the knowledge and the understanding and how to best communicate with your physician and other allied healthcare practitioners so that they all have a collaborative mindset on how to best treat the patient. So really, I think that's how we'll collaborate together in educating patients to live better quality of life.
Thank you, Cheryl. So I think we've talked a little bit there about the importance. We've talked about some of the ways in which we're working together to try and incorporate this patient voice. So I guess my next question is potentially slightly controversial, but to Ricard, will it work? Do you, as a healthcare professional, believe that healthcare professionals are receptive to hearing what patients have to say and the areas in which they need to improve?
Well, certainly we must be receptors. Probably in the past it was not in this way, because you know that sometimes it's difficult to change the way physicians think, but especially in the field of lupus, having incorporated the patient's voice in all these activities that I summarized before has been of paramount importance. So we really nowadays consider that an important part of our work is to work in addition to visit the patients in our consultations is to work with patients associations, with different patients boards, with JAR representative patients advocates, in order to design better projects, and educational activities, better design of the different sections of our hospitals or of our clinics. So it is absolutely essential for healthcare providers to consider the patient as one more of the team.
Cheryl, one last question for you. I know you need to jump off, but as a member of a patient society, as a patient advocate yourself, do you see healthcare professionals as being receptive to this education or the patient voice when you try and provide it?
You know, I think that the relationships are changing. You know, when I look back at my grandmother, and you know, and when she was alive, she went to the doctor, and I don't want to say that she wasn't educated, but she trusted, and we still trust our doctors, but she didn't have that ability to have the knowledge that our patients have today. So, you know, I think that our physicians are wonderful at what they do. They are very well educated. They are very, you know, they're there for their patients. But it is really a team. It is really the physicians, I think, need and do understand that patients come to them and want to have some, I want to say, be in charge of their life. It is their life. And the physicians, I think, want to help those patients live the best quality of life that they can. So how do we do that together? Because it is a partnership. The physicians are providing the expertise, the knowledge, the guidance from the medical perspective, but the patients have the opportunity to share with their physician, this is how I want to live my life. So it's really about that collaborative effort, about being able to communicate with one another and say, this is what I want to do with my life, or this is how I want to live my life, and how can we best work together? So I think, absolutely, I think that change is happening over, you know, over the course of probably the last 10 years, maybe the last 5 years, and well into the future. And I think doctors are receptive to that because, again, when you have a patient who's well educated in their disease and their diagnosis, adherence to treatments, potential adherence to a clinical trial or a new treatment option will be better when the patient understands why they need to have this treatment or why they need to take this potential treatment for themselves to live a better quality of life. So I think, yes, I think that collaborative and that, you know, that collaborative effort and that partnership is much needed and is there, and looking forward to the future.
Thank you, Cheryl. And thank you so much for your time today. I know you need to jump off now, but thank you for joining us.
Thank you.
Cheryl made a really interesting point there, which is, I think sometimes we're surprised as to what the patients have to say, and maybe it's something slightly different than what we were expecting them to want. And Emma, I'm going to put you on the spot here a little bit, but I know that you have a little nugget of information that surprised us at the SES team recently as part of one of our literature reviews we were doing routinely for the education on our hubs, and something which jumped out and surprised us. So Em, would you mind sharing that with the group?
Of course. I've recently sat on a literature review. It was actually for multiple myeloma, so it was a slightly different indication what we're discussing today. But something that the team came across was actually a discrete choice survey that was sent out across Europe. It was England, France, and Germany, and they had 300 people take part. It gave them the option of rating 8 different type aspects to do with being treated, from life expectancy, risk of infection, fatigue, and it asked them to prioritize, firstly, what was the most important to them, but also then to rate what that meant exactly. So for example, 95% of people said they would tolerate treatment with medium levels of pain for 2.7 years of survival, life expectancy. 95% said they would tolerate extreme pain for another 2 years. We also had quite conclusive answers regarding fatigue as being quite a strong indicator of affecting quality of life, but also quite interestingly, which can be interesting, is the perception of what a healthcare professional might see, which is actually the current status of the disease was not a deciding factor in what they would tolerate treatment-wise. So people who were newly diagnosed or also relapsed or refractory both had the same answers when it came to the type of treatment they'd be prepared to receive to extend their life. So the conclusion for this was that the current health state influenced treatment preferences over the disease status. And this is something that can be very much involved in a PAG conversation with the patient collaboratives, with the healthcare professionals, and can then be, as we mentioned, we're talking about educating other healthcare professionals outside of these discussions, could then be delivered via the platform itself to the audience space. So I thought it was just quite interesting how things could be perceived maybe by healthcare professionals, but how they actually are received by the patient. Thank you.
Thank you, Emma. And Carl, potentially you could comment on that with your patient hat on. Is that surprising to you?
Well, we actually do basic research into the disease, but we have done something very similar in the Netherlands, where there's a piece of research about what patients want to do in terms of disease choices, and we're funding expansion of that beyond to other countries, and the results are indeed very interesting. I'd also like to go back to something that Richard said, who talked about the disease not being the same, and our disease presents itself differently. Our disease is really two diseases. We have too much IgM, which is like the first responder to infections, and it does one of two things. It either gets into your blood marrow, bone marrow, and crowds out other things, so you don't have enough white blood cells or red blood cells and you get anemic, or it decides to take vacations around the body and ends up in places that oughtn't to end up in, like, I don't know, the nerves, where there's a lot of peripheral neuropathy. So patients present with very different things, and you need to talk intensely with the patients. And also, back to something that Cheryl had talked about, we're also increasingly interested in quality of life. Because when I was diagnosed, I said I had 3 to 5 years to live. Now we tell people they have 15 to 20. And there used to be 4 treatments, and now there are combinations of drugs that are at least 40. So it's very important that the doctor and the patient talk about what's the right treatment now. And for most of us, we have periodic cyclical treatments. So you're going to get a treatment, and then 3 years, 5 years, 10 years, maybe even 20 years later, you're going to need to be treated again. So the quality of life is essential, and the communication between the doctor and the patient about what's the game plan now for this treatment, and thinking ahead, what's the game plan for future treatments is essential.
How do you believe the work that you're doing in collaboration with SES will enhance those patient outcomes?
I'm sorry, that's a question for me?
Yes.
Absolutely, because the more the patient knows, the better they communicate with the doctor. The more the doctor knows, the better they can see the options. And then again, the more complicated the cases, they can then refer to our international team of doctors who can provide second opinions, and therefore get the best treatments in the most serious cases now.
Thank you. Ricard, as with your healthcare professional hat on, is there anything that you've heard today that has surprised you from?
Well, I can see that probably the feeling of the patients is quite similar in very different conditions. We have listened to the feelings of patients with inflammatory or autoimmune diseases. We have heard on the feelings of patients with malignancies, and they share many of these feelings. Regarding lupus, there is another aspect, another very, very important aspect that we have also to emphasize and to do patients' education, is that the majority of the patients with lupus are females in their pregnancy years. They are in the 20s, 30s, and 40s, and so all the aspects related to pregnancy are also extremely important for our patients. So this is an additional thing that we have always to emphasize in our educational activities. All the aspects related to females' lives.
Thank you, Ricard. So audience, we are nearly at the question and answer stage. If you do have any questions, then please do pop them in the chat for us to put to the panelists. If not, we'll carry on talking a little bit longer and hopefully giving you some useful information. We did have one last question we posed to Lyndsy that she's recorded an answer for us, which was, as a patient yourself, how have you found working as a Lupus Hub steering committee member with the SES team?
I found being a patient representative on the Lupus Hub steering committee really, really interesting. From a more personal perspective, I think it's just fascinating to hear about all of the different hot topics in lupus at the minute, which are things that I might not have heard about otherwise, and I certainly wouldn't have heard the different perspectives. So I think that's been a real highlight for me. My experience as a patient representative has also been really, really positive. The clinical committee members and the SES team have been really welcoming and have provided plenty of opportunity for me to share my views on whatever it is that we're talking about, and I feel comfortable sharing my own experience where that is relevant, and so it's great to feel like I'm contributing to something useful and putting that experience to good use. So that's really great, and it feels really positive. I also think that it's good to hear that the Lupus Hub team are thinking about how they can build on what they've done so far in terms of incorporating the patient voice to make the hub even better going forward. So I look forward to seeing what that looks like.
Yet had any questions come in from our audience? So, Carl or Ricard, do you have any final comments on this topic before we close?
I'd just like to say thank you again to the SES. You've been an invaluable resource to us as we go about expanding our patient access globally. We've got 20,000 some people in our database from over 80 countries, but they don't all have an equal chance at education and support, and we want to do that. And we also have, we figure the more doctors that know about us, the more they'll tell the patients, and the more we'll be able to educate and support people. And then the doctors will learn from their patients, and the better they'll be able to treat our patients. So you've been, again, an invaluable resource to us, and our project of Global Patient Initiatives working smoothly, and we appreciate working with you.
Very much appreciate working with you too. And in fact, Lucy's going to say a little bit about that in the next couple of slides. Before she does, Ricard, did you have any final words for the audience?
Yes, I also want to thank you, SES, for your support in education to all this community, embracing healthcare providers and patients, but especially I want to thank the patients that you devote part of your time, hard time, because we know that you are patients and that you have all these problems that you mentioned before. And even with this, you devote part of your time to this, to sharing your feelings, to improve our work, to do education to other patients, and also to educate we physicians, and also to encourage we physicians to better know how are your diseases, to make better research on these diseases. So thank you very much.
Thank you so much, Ricard. You couldn't have put it better. We have had a question come in, so I think we've got time to answer it. It's to you, Carl. So as a patient advocate and based on your experiences as a patient, what is the most important element you would ask doctors, industry partners, and other advocates to change or address?
So I would say the most important thing that we need to do is we all need to talk together and work together. And the IWMF has physicians on our board. We've got a global scientific advisory committee. And the important thing is we all need to do one thing. The enemy is the disease. And our disease, WM, is a wily disease, and it keeps changing and doing things. Just when we think we've got it in the corner, it slips away on us. And as Ricardo was saying, we've spent a lot of money on research, and we're making enormous progress. But all that progress requires community cooperation across everyone: the patients, the caregivers, the nurses, the doctors, everybody. And if we could all work together, we can defeat this thing and get to a world without WM. And you guys are helping us a lot in that area.
So collaboration is key, and being open to each other and listening to that patient voice. So we're going to jump just back to the slides, and Emma and Lucy are going to share briefly some cases of the work which we're doing at SES. Once they've finished, we will close the session. We do have a really short feedback survey where we are asking for your opinions on today. We really hope you all enjoyed it. But also, if you are interested in speaking to the SES team about how you can support us continue our work in incorporating the patient voice across all of our healthcare professional education platforms, then within the feedback survey, there is an option to set up a meeting with us. So we'd love to talk to you if you're interested in hearing more. Over to Emma, I believe.
Thank you, Mia. I just wanted to touch on something Carl just said then, which was patient advocacy and collaboration with healthcare professionals is great, obviously, but it's actually being able to hit a larger number of the healthcare professionals to really make that difference. And this is what the aim of the PAG is. The patient advocacy group is to really get as many people aware of the patient voice out there, and to also communicate in a style that suits a healthcare professional as well as a patient. So it's to find that middle balance, and a way that this can be supported and can be help with the growth of the PAG in particular is for all of the pharmaceutical industry supporters that we have, or anybody out there, to help support in raising awareness and getting the word out there. So just to reiterate what Mia said, we would be looking for people to be contacting us to learn more. So with the survey that comes out, that would be great if you could request for more information, because it does take all three aspects to align to really make the most effective treatment pathway and care towards patients. Thank you.
Thank you very much, Emma. Beth, could you advance the slides for us? So, did you have anything more to say on this slide? This just kind of summarizes a little bit about what the aims of the PAG are, which I think you did. But
I did. I just didn't wait for the slide.
That is no problem. So, Lucy, over to you.
Thank you.
Slide, please, Beth.
Thank you very much. So I don't really know what I can say about the partnership that we currently have with the IWMF that Carl hasn't so eloquently and perfectly summed up already. But I don't think that any activity better embodies why this is so important and what we can achieve when we work together than the work that we're doing with the WM Global Awareness Building Initiative. So as Carl explained, the IWMF are the patient-founded and patient-driven not-for-profit organisation, and they improve patient outcomes whilst advancing the search for a cure. And our joint work together increases awareness of WM. It does it through healthcare professionals, patients, caregivers, and the patient advocacy community across the world. So we do this through the Lymphoma Hub, through SES's independent medical education platform, and the initiative shares new data, evidence-based articles, therapy approvals, and expert opinions on WM. And this supports HCPs, and it supports them by helping them make informed treatment decisions and ensuring that patients have access to the latest support and treatment options. And our first examples of WM community accelerated learning have quadrupled engagement numbers within the first quarter, and the downloadable treatment WM landscape infographic was shared in hard copy with over 100 physicians at the recent educational forum in St. Louis. So running in parallel to this HCP-facing education, together we deliver a year-round dedicated awareness campaign. And this is targeting patients and carers within the WM community. So this actually includes ongoing campaigns in social media And this is through the IWMF Torch community as well. And this includes the creation of patient-focused WM content, such as expert interviews, downloadable resources, and the patient manifesto, which I know has just had its name changed, Carl and Beth. So I can share that with anybody who's interested after the call. But most importantly, these assets can be downloaded, they could be translated into local language. And this means that we can offer content in over 100 different languages, and these permit a truly global reach. And this really speaks to what Carl was talking about in terms of breaking down barriers, giving people access to medical education, and really just sort of making sure that people have the best information that they have to enable those communications with their physicians to just sort of close the gap and improve outcomes for everybody. And when we work with our supporters within this initiative, they can also be guaranteed that their investment is supporting learning and addressing unmet educational needs within this specialist area. So again, I'll close by just saying, if you have any questions about it, or if you want more information about how you can work with us to support this incredibly important initiative, then please do contact us.
Thank you very much, Lucy. And that brings us to the end of our webinar. So just from me and from the SES team, thank you so much for joining us today. I hope you found it helpful, and I hope you've learned some useful things or got your thinking caps on how you can do the same and incorporate the patient voice into any education that you do. And if you are a supporter listening in, then as Lucy and Emma said, please do get in touch. We'd love to speak with you. And finally, a huge thank you to all of our panelists who joined us today, spoke so eloquently, unlike myself, and managed to get that message across clearly. So thank you all and have a lovely afternoon.